Every 33 seconds, someone in the US dies from heart disease. It's a leading cause of death in the US and the UK. In the US, an estimated 80 million people have one or more kinds of heart disease. In the UK, heart and circulatory diseases cause more than a quarter of all deaths. The classic symptoms experienced by the people with heart disease are chest pain and chest tightness, shortness of breath, and pain and numbness in the arms. Besides, people with coronary heart disease or who have had a heart attack are twice as likely to have a stroke. Unfortunately, in many cases, people with heart disease do not experience any symptoms, and the first symptoms itself is death. The current pharmacological treatment includes either cholesterol-lowering drugs, aspirin, beta blockers, or calcium channel blockers. When it comes to surgical intervention, one of the options is coronary artery stent. In this surgery, stent or balloon has been placed in one of your blood vessels that takes blood to the heart. The inflated balloon broadens the artery and ultimately increasing the blood flow to the heart. Second surgical intervention is coronary artery bypass surgery. In this process, graft has been created to bypass blocked coronary arteries using vessels from another part of your body. This allows blood to flow around the blocked or narrowed coronary artery. What causes heart disease, and is there anything you can do about it? Well, look at the statistics. According to British Heart Foundation, approximately 94% of deaths caused by coronary heart disease are attributed to modifiable risk factors. What does that mean? It means that the risk factors you can control, for example, your diet, exercise, high blood pressure, and high cholesterol. Amongst all these factors, poor diet has been a major risk factor and attributed to causing 70% of all deaths related to coronary heart disease. The Western diet is dominated by processed foods, meat, dairy, eggs, and oils. The problem is, pharmacological treatment address the immediate symptoms of heart disease, and surgical interventions like bypass surgery and artery stent can be life-saving for the patients who have undergone a heart attack, but none of this treatment addresses the underlying root cause: standard Western diet. Some heart patients may receive nutritional advice from the dietitian or nutritionist who often lacks the knowledge and training of evidence-based disease prevention and reversal. A whole food plant-based diet has been scientifically proven to help with the management of heart disease. It's not a new knowledge that diet full of fruits, vegetables, whole grains, nuts, and seeds is not just healthy for heart, but also good for overall health. Besides, plenty of studies have established this fact. The solution is so simple, but it's not easy to implement. The problem is, you might have eaten this way pretty much your whole life, and probably all of your friends and family members too. You don't know how else to eat. After all, it's a whole lifestyle change. The whole food plant-based diet can be a great concomitant therapy for your heart disease. At Holistic Health Support, we partner with well-trained nutrition and health coaches who have knowledge of evidence-based whole food plant-based diet to manage chronic conditions. If you or your loved ones need help to make a transition to the evidence-based whole food plant-based diet to manage your heart disease, we can help you to find a suitable nutrition coach. All you need to do is click on the link in the description and finish the questionnaire, and we will ensure to book you a free appointment with one of our health coaches. We look forward to see you there. Thanks for watching.